Hello, everyone. My name is Mahati Sudhir, and I am the president of the Teen Mental Health Initiative. First, I'd like to thank everyone who is able to join us today for our very first Teen Mental Health Initiative presentation. Before I begin the presentation, I'd like to briefly give some information about this organization. Holistic Health Alliance's Teen Mental Health Initiative, or TMHI, is a youth brigade student-led initiative dedicated to raising awareness on the subject of teenagers' mental health issues and connecting them with resources to mitigate the occurrence of those issues. With the rising mental health epidemic in our nation, it is crucial that we bring awareness to the mental health struggles that our youth face. The Teen Mental Health Initiative does this by organizing various awareness events and fundraisers, posting informative social media content, including these presentations, and providing educational blog posts that you can find on our website. For anyone who is deeply passionate about mental health advocacy or simply wants to know more on this topic, please scan the QR code on the screen to join our team. And with that, I'd like to begin my presentation on the general overview of schizophrenia. But first, a disclaimer. I'm not a medical professional, and this presentation is not meant to be used as medical advice, but it is rather to be used for educational purposes only. I'm not an expert in this field, and this presentation simply includes a general information gathered from reliable sources and is based upon my own research. So what is schizophrenia? Schizophrenia is a chronic mental illness that affects how a person thinks, behaves, and feels, and it usually involves periods of psychosis or a break from reality. So in the US, schizophrenia affects about 1.1% of the population, or about 2.8 million adults. Schizophrenia is usually diagnosed in the late teens or early 20s, and there are no gender differences or factors related to the increased risk of schizophrenia. However, it's been shown that schizophrenia can develop earlier in males, so about in the early 20s, than females, which is about mid to late 20s. The symptoms of schizophrenia are generally categorized into three groups: positive symptoms, negative symptoms, and cognitive symptoms. So positive symptoms or psychotic symptoms include various aspects of psychosis, such as visual and/or auditory hallucinations, delusions or having strong beliefs that aren't true and may be irrational, and thought disorder or unusual ways of thinking. Negative symptoms include social withdrawal, having a monotone speaking voice or limited facial expressions, which is also called flat affect, as well as low energy and motivation, also known as avolition. Extreme cases of this can include catatonic states, and which is where a person stays in one position for an extended period of time. So then we also have the cognitive symptoms, which include trouble with cognitive abilities, such as memory, attention, and decision making. So though we don't know the exact causes of schizophrenia, we do have some inferences based off of various research and studies conducted on this topic. We do know that there are genetic factors, environmental factors, and anatomy/biology factors that we have noticed are common within people with schizophrenia. With genetics, we know that schizophrenia has a very strong genetic component to it, with it being about 90% heritable. We do not know the exact genes that play into the role of developing schizophrenia, however, and there are a lot of theories floating around on that. So moving on, the environmental factors. So studies have found that environmental factors play a pivotal role in the onset of schizophrenia, probably by turning on or off genes that may be related to the development of schizophrenia. For example, home environment can play a role in the onset of schizophrenia, as well as poverty, stress, or exposure to certain viruses in the womb before birth. Lastly, there have been consistent findings about brain structure and functioning abnormalities linked to schizophrenia. One of the most common findings in many studies was the discovery of an overproduction of the neurotransmitter dopamine within the brains of people with schizophrenia. And also, it has also been found that ventricles, it has also been found that a lot of people with schizophrenia have enlarged ventricles in their brains. And ventricles are just these holes or spaces in your brain that hold cerebrospinal fluid. And you can see here in this picture on the top right that the holes are larger in a schizophrenic brain rather than a normal functioning brain. And the enlargement of those ventricles can also mean the shrinking of the frontal lobe, which could explain some of the cognitive symptoms that we previously discussed. So now for the diagnosis. How is schizophrenia diagnosed? Well, firstly, you have to rule out all other possible diagnoses or causes of psychosis or psychotic episodes, such as drug or alcohol use or other mental health disorders. People are usually diagnosed with schizophrenia between the ages 16 to 30, and it is usually diagnosed after the first psychotic episode. However, the abnormal changes in mood, thinking, and behavior can also occur before the first episode of psychosis. So, how do we treat schizophrenia? The most common treatment for this mental illness is medication, which most commonly includes antipsychotics. Antipsychotics make the positive symptoms of schizophrenia less likely to occur, or occur less frequently by blocking dopamine receptors in the brain. However, they do come with side effects. Along with these antipsychotics, psychosocial therapy, treatment can also be utilized, helping the individual deal with symptoms in social situations, such as attending school or work. And this treatment can also help reduce the frequency of symptoms. For people in the early stages of schizophrenia, coordinated specialty care or CSC treatment can be used. CSC is where healthcare providers and specialists and the patient work together to discover and provide the best treatment options for the patient. And lastly, education of the disorder can be extremely useful, not only for the patient themselves, but also for the families of the patient, helping to understand the disorder as well as how to treat it. Overall, schizophrenia is an incredibly stigmatized mental illness that requires a lot more research, so that we are able to fully understand the causes of the illness and so that we can develop and offer proper and more effective treatment options for these individuals affected by the disorder. Now I would like to open it up to any questions that anyone would like to ask.
Yeah, great presentation, Mahati. So I do have a question. Is there any way to prevent schizophrenia, or is it just mainly managed after diagnosis?
Um, so like I mentioned, schizophrenia is more of a genetic disorder. So um it has a really strong genetic component to it, so it can be like hard to prevent the development of it. However, there are the treatments. Antipsychotics are the most common, and they're the most effective ones that we have so far to help deal with the symptoms of it.
Yeah,
Um,
thank you. I was also wondering, like, what are the main challenges in diagnosing schizophrenia, like earlier rather than later?
so earlier, um, like I mentioned, it's hard to do that because usually schizophrenia is diagnosed within like after the first episode of psychosis. Um, so it can be kind of difficult to diagnose it before that because psychosis is like kind of a defining factor of schizophrenia. And also schizophrenia is actually confused with a lot of other mental health disorders. For example, dissociative identity disorder, DID, where you have like multiple personalities, but that's confused with schizophrenia a lot. So there are other disorders that can be confused with that.
Thank you.
Do we have any other questions?
I had a question on the fact that it's genetic. Is it like passed down through like family heritage?
Yeah. Yeah, it is
Okay,
90% heritable.
thank you.
Yeah.
Really good presentation, Matthew. Really good information, I would say.
Okay. Thank you.